So yes, MRI specific absorption rate, or commonly known as SAR, can be higher in individuals with higher body fat. SAR measures the rate at which rate of frequency energy is absorbed by the body during an MRI scan, typically in watts per kilogram. In people with higher body fat, the SAR can be greater because the body composition, right? So the fat tissue has different electrical properties, lower water content and conductivity than lean tissue, which can lead to higher energy absorption in certain scenarios. Okay, now the body size, larger body mass increases the volume of tissue exposed to the radio frequency field, potentially raising the overall SAR. And also the coil interaction, the proximity and interaction of the MRI coil with a larger body can alter the electromagnetic field distribution, potentially increasing the local SAR. So generally, yes, the less body fat can lead to lower a specific absorption rate during an MRI. Leaner individuals typically have less tissue mass and higher proportion in water-rich tissues like muscle, which have different electrical properties and may absorb less radio frequency energy compared to fat tissue. Now, I mention all of this because I want to show you a fat person's cervical MRI. Now, this one is a T2 sagittal image right in the middle. So it's a mid-sagittal T2 weighted. Okay, so we have this person. Now, if you can look in the middle right here, I'm going to show you. This would be the spinal cord. Okay, now it all goes down all the way to thoracic. All throughout the vertebrae. And you can see here that is a little grainy right in the middle, right there, right? And that's because it's just having a harder time to get that image looked at, if you will, because of all the fat. Now, the bigger the patient is, the grainier your image is going to be, unless I give it more time, increase the time, right? The next, that's eventually going to create better images, but you're going to be there a longer time, and your SAR is also is going to increase more because I have to do continuous scanning of your anatomy. Now, if we look at the one on the right up here, this one is lean person, okay? So not a fat person, and you can see that the spinal cord, which is right in the middle here, looks way better than the one on the left. Okay, now I want to point out where the fat is so that everyone knows. The fat is right here. All this white stuff we're seeing right here, that's all fat. If you look at the one on the right, less fat. Okay, so look at that difference between the right and left. I'm place them together now. Well, that's not going to follow through, but as you can see, we have the big difference, and that is important for image quality in MRI. Thank you for watching.